The mental health problems that are common among parents among women in particular when they first have a baby, are the difficulties of adjustment. So getting used to the big changes in their lives, the extraordinary fatigue that they can experience, the loneliness. But one of the things that I think we focus on here is how women can feel very incompetent and unskilled. And in that setting, especially if they have an unsettled, crying baby, their confidence can diminish, their anxiety can increase, and in that situation they can develop quite low mood, including at worst becoming depressed. Major depression, if a woman experiences that, is characterised by quite a lot of symptoms of depression, so feeling low and sad, feeling as though things that should be pleasurable are not pleasurable, feeling quite hopeless about the future, feeling lacking in energy, lacking in drive. If somebody experiences that most of the time, most days, for a period of at least 2 weeks, then they meet the criteria for being depressed. But what we find here at the Mother Baby Unit is what is more common is for women to feel anxious, isolated, irritable, as though their normal problem-solving strategies are not working so well. So we're pretty confident that here the problem we deal with much more commonly is what might be called adjustment disorders or adjustment difficulties with anxiety or with a mixed anxiety and depressed mood. Well, look, I think every woman has heightened or changed needs when she has a baby. And some women have the good fortune in that circumstance to have a baby who's quite easy to look after, lots of support, a partner who's available and willing to engage with care of the baby, a workplace that's given them parenting leave, including some income support. I think in those circumstances, usually women can manage this phase of life without needing a great deal of extra professional support. But of course many people are not in those circumstances. The women we meet here at Masada's Mother Baby Unit tend to have had quite difficult reproductive lives. We have a disproportionate number of women who've had difficulty conceiving and have had infertility treatment. They might have had a premature baby or a caesarean birth or been separated from their baby because the baby was sick or had special needs at the beginning of life. Many have had difficulties establishing breastfeeding, and all of the babies are unsettled, which means that they cry a lot for long periods and they're very difficult to soothe and settle to sleep. So together these get called problems of infant regulation. And we know that if you happen to have a baby like that, this can be one of the things that contributes to low mood, reduced confidence, some of the difficulties we were talking about earlier. Well, I think sometimes it can be difficult even to recognise in yourself that there is a heightened need, and then the next step needs to be that that need is legitimate and it's reasonable to seek help. But the big problem is, where do I go, who do I ask, and what is it that they might do that is helpful for me? Early parenting services like ours are not accessible to everybody. Australia is very unique in even having these services. But I think once someone has begun to think that there might be something that could help, the first step is to go to a GP or to talk to your maternal, child and family health nurse. And it's hoped that those people will be a better access point to the resources that are available locally.